I'll wait till that pops up. There we go. So welcome to our July-August call. This is our genetic ambassador call for July-August for Mountain States Regional Genetics Network. We usually start off with a couple introductions just so we all can get to know each other and know who is on the call. So I will start off with my introduction. I'm Christy Weiss. I'm the Consumer Engagement Director for Mountain States Regional Genetics Network. And I help lead these genetic ambassador calls. This call is special today because we are wrapping up our Serving on Groups training that we started at our last genetic summit last October. And we've been doing one or module each month or so. And so we are finishing that up today. And I am joined with Susan Owens, who's one of our longtime genetic ambassadors with Mountain States. She and I took this training together about 2 years ago in November at a Family Voices conference. It was a Train the Trainer. And so she has graciously agreed to help me present this session today. Susan also is a researcher with the Autism Oxalate Project at ARI. And Susan, I'll let you go next to introduce yourself if you'd like to add anything to that.
Well, ARI is the Autism Research Institute, and my project has grown from being just about autism to being all sorts of different conditions where oxalate is present, and certainly genetics is part of how it expresses itself differently in different people. So I have more reasons to be interested in genetics than just my own family.
Great. Thank you so much for joining us, Susan. And let's see, I'm going to go down my list. Daphne, do you want to introduce yourself?
Hi, I'm Daphne Fulton, and I have a grandson with, mine just went blank, vascular Ehlers-Danlos syndrome. And we work with a group called Ryan's Challenge. I'm also a health professor at Sam Houston State University.
Great. Thank you so much for joining us, Daphne. And Alyssa, do you want to introduce yourself?
Yes, hi. I'm Alyssa Seymour. And my daughter, Allison, was diagnosed with Williams syndrome when she was 10 months old. And I'm going to be going on almost a year with Mountain States. And I really enjoyed myself and learned a lot. So.
Yeah, Alyssa joined us at our first summit. It's the first time I got to meet you. You were on our consumer panel with Susan, right? And Heidi at our first genetic summit last October. So thanks for joining us today. Yeah.
Yes,
all right. All right. And then let's see. Winston, can you hear us? Or are you able to talk? I hear an echo. Somebody's phone, no? Okay, we'll skip over Winston for right now. If you're able to introduce yourself when we're done there, just speak out. And I have somebody from a 702 area code. Would that person like to introduce themselves?
Yes, hi, my name is Maricela Quintero, and I'm from Las Vegas. I have a 9-year-old with Rett syndrome. She was diagnosed at the age of 2.
Great,
first time on the call.
Thank you for joining the call, Maricela. It's so great to hear your voice.
Oh, thank you. I'm happy to be here.
Yeah, thank you so much. All right. So for you, just a little bit of context, this Serving on Groups training has been going on since our last genetic summit. Like I said, we're wrapping it up today, but you can catch some of the other sessions on our webpage. So I'll make sure you have that link.
Okay.
All right. And then is there anyone else that's joined us that I haven't called your name?
Yes, this is Mary Meeker in Reno.
Oh, okay. Mary, I heard Mary and somebody else.
It's Casey, Christy.
Oh, hey, Casey. Okay, Mary, you want to introduce yourself, and then Casey, you can go?
Yes, this is Mary Meeker. I am the Executive Director for Family Ties of Nevada. I also have 2 adopted children with special needs, one including fetal alcohol syndrome. So I am, part of this group and really enjoy it, and that's about it for me.
Great. Thanks for being with us, Mary. And Casey, do you want to go ahead?
I'm Casey Singletary. I'm the mother of my middle has PKU, and I'm state for Mountain States.
Great, thank you, Casey. And there was a little bit of an echo, but she said that her son has PKU, and she's on the one of the state team co-leads for Texas for Mountain State. All right, so is anybody else joined us? Are we ready to get started? I'll give a shout out to Winston one more time if you can talk or not, but maybe not. Okay. All right. Well, if everybody could put their phones on mute, that will help the call quality a lot, if that's possible. So if you could just put your phone on mute while we're doing the presentation, feel free if you have questions when we open it up for questions and stuff to unmute yourself and ask. But Susan and I are going to go through this Serving on Groups session on data, and we will get started. Can everybody see the slides? We good? See section 6 up there? Susan, do I have a thumbs up? Can you see it? Okay, good deal. All right, so we'll get started. So this session is about using data as information. And it's actually section 6 of 8 sections, but we skipped ahead and did section 7 and section 7 and section 8. So we're jumping back here to pick up section 7. So one of the main questions we'll be answering today is, what is data and how do we use it in the groups that we serve on? So data is simply numbers, but it doesn't have to just be numbers. I think most of us know data to be numerical sometimes, but there's a lot of different types of data, and we'll be talking about that as well today. How do we use data every day? Some examples that they shared with us when we were doing our training is, if you're having a family dinner, and for your family, it takes 12 tortillas for Taco Tuesday, but you have 7 more guests coming. How are you going to figure out how much more you need? We use data in every part of our everyday lives, figuring everything out from serving dinner to guests to many of us in our jobs on a day in and day out basis. We're going to talk about the stages of data use, and we're going to break those down into manageable chunks. And then we're also going to answer how is the data going to be used that we might be collecting in our groups. So let me change the slide here. So data, as we said, it can be factual information, and it can help groups make decisions. The biggest things that we need to remember about when we use data in the groups that we serve on is that it needs to be reliable. What does reliable mean? It means that the data is accurate and true every time. And would it be the same if somebody else collected the data? That's a key thing to remember for reliable. The data must be valid. Valid means that the data reflects a truth and produces a desired result. In other words, an example of this, another way to ask this would be, does the data measure what it claims to measure? And it needs to be accessible. And so that means that it needs to encompass all concerns, needs, and abilities of the audience. It needs to be considered when using the data and collecting the data. Excuse me. All right, and then one other note here about confidentiality, because when we do collect data from different groups of people and the groups we're serving on, we do need to be aware of this. So confidentiality is just simply a set of rules that a person makes or an organization makes to limit access or place restrictions on data. A lot of times in data that has to do with individuals and families and individuals with genetic conditions, this is sometimes gathered through something called informed consent. We're not going to go into a lot about that today, but I just want to throw that term out there for you, because that gets thrown around a lot in the data world, is that you're informing the group who you're gathering the data from how it will be used, and you're certifying to them that it will not be used outside of those parameters that you have discussed. So this is just a note that we need to be conscientious of, is confidentiality of data. Let's see, there we go. So as I said in the beginning, we talked about the forms of data, and I said, we often think of data as numbers, and that is one type of data. So that would be quantitative data. Is typically numbers. It typically answers the question how much, how often, when, where. But there's also another type of data that we often use a lot in the regional networks structure, and that is qualitative data. And the difference between the two is just that qualitative data are typically descriptions. They answer questions like, what is it like? What do you observe about it? In this current grant cycle, we talk a lot about barriers to access to genetic services. And so sometimes you can count those barriers quantitatively, and sometimes you can't. Sometimes you have to ask people in a survey or in a focus group or in an interview to get down to the root cause or the root barrier and have them describe it so that you can come up with solution-based approaches. So these are the two main types of data, the quantitative, again, being numerical, the qualitative being more descriptive. And we added this slide as Susan and I were preparing for this presentation because we realized that there's some challenges that different individuals might experience when they're using data or they're trying to use data in the groups that they're serving on. And there's kind of 3 different levels we were talking about of experiences that you might come into contact with data in a serving on groups experience. So for instance, when you have your own experiences, maybe with your own child or your own genetic condition, you might have differences or commonalities between what you have experienced and the data that you've collected personally on your experience versus what the group you are serving on already knows or believes. Going up another level, you might find differences and commonalities between the disease-specific or genetic condition community that you serve, that you are representing or serving in. For instance, for my daughter was suspected of a mitochondrial disorder. So if I'm serving on a group and I'm representing all of those other individuals with mitochondrial disease, that might look different than my own personal experience with my daughter. And so we have to take into account the bigger picture of the disease-specific community that you might be representing on a group. And then stepping back one more step further, there might be differences and commonalities between the larger group you are representing. So when you're serving on a group, you might not just be representing that small disease-specific community or your experience with your child or your own experience, but you might be representing all of children and youth with special healthcare needs, which is a very broad description of a rare disease community. It's not a tiny subset of data. So these are just some things to keep in mind as we're going through this. And when you are serving on groups, is to consider your data source personally, your disease-specific community, and then the greater community that you might be representing, for instance, the entire rare disease community or the entire genetic disorder community. And as Mountain States, we are in this last category because we are a group made up of a wide range of individuals. So we have to keep this in mind when we're talking about data as well. So this brings us to the slide where we talk about, this is kind of our outline for today's talk, because we're going to walk through these 8 different stages of data use and go into a little bit of detail about each one. We could probably spend a whole presentation on each one of these, but today it's going to be an overview. And if you have any more questions at all, please feel free to reach out to myself or Susan. And then we also do have the guide that we handed out at the summit, which is the Spiral Bound Guide. And Maricela, I know you were not at that summit, so we have a couple extras of those. If you would be interested in having one of those, please just email me your address and we can get one of those in the mail to you. And if there's anybody, Winston too, if there's anybody else on the call that would like one of those guides that was not in person at our event, you can write to us and or send me your address and we can get one to you. So we're going to start off with planning and preparing to use data, and then we're going to go right around the circle. So start here at the top. When we're planning and preparing to use data, we're really asking the question, what do we want to know? And a great way to do this, I know from my conversation with Casey this morning, asking a focused question can really help this. So for instance, when we started this grant cycle, one of the main asks of Mountain States and the other regional networks was increasing access to genetics care for underserved populations. That's a really broad broad topic. So we started asking more focused questions in the Mountain States. What is genetic services? Who are our underserved populations? We had to drill down to the details, and we drilled down even further to the details by forming state teams and asking our state teams. Texas, who is your underserved populations in your state? Nevada, who are your underserved populations in your state? So this can really kind of make a funnel that might be very wide, taking a very wide topic and trying to drill down to get the data. We have used a variety of methods and sources, and when you're at stage 1, you have to use a variety of methods and sources of data. You have to find data that's already out there, and actually HRSA asked us, hey, what's your baseline numbers? How many clinics in your region are using telegenetics? That's a baseline number. We need to know that from when we start the grant so we can measure if we increase that. As I mentioned before, we've tried to find gaps and barriers to care, and so these have sometimes been done with qualitative data, like interviewing individuals and families and geneticists and genetic counselors in our states. Pinpointing those possible roadblocks is another way to get to the bottom of preparing to use the data, and asking others who are knowledgeable of the data, which we rely on each and every day with our very knowledgeable network of members in the Mountain States. The second stage will be collecting the data, and the collection of the data can take a lot of different formats. There we go. There's our slide. We can collect data a number of different ways. So there's actually quite a bit of data that already exists out there. And we have some links in the end of the slide presentation for some of those sources. But you can use child and youth data. There's demographic data out there. There's stakeholder perceptions. There's process data. A lot of this data is available for free on governmental websites. But then we can drill down another level and use families and family organizations as data sources as well. And we've done this in the Mountain States as well. And I'll use Mountain States here as an example, because in our first year of funding, we did surveys. We did family surveys and genetics surveys of geneticists in some areas that represented underserved populations in our region. So for instance, we did outreach to the Tuba City and the Navajo population there, to San Antonio and the Hispanic population there, and to Grand Junction, Colorado, and Durango, because of the rural population there. That gave us some data. It was very much qualitative data, but it was a starting place. We can also talk with participants and attendees to different events and functions, and we can also ask perception data. What is the perceived roadblock from you getting to a genetics clinic? And that perception data can be very helpful as well. So I'm going to stop here and shift gears over to Susan, and she's going to take it for step 3 here on organizing data. And Susan, just let me know when you want me to advance the slide.
Okay, will do. So we're going to be talking about organizing the data, and I think you need to press something to get it to do that little blue line. But the third step is trying to put the data in a form that helps others to understand it. And so data is organized for different purposes. You always have to keep your own purpose in mind. Finding the right way to organize the data should depend on both your audience, like who are you trying to communicate this to, and what sort of data you're trying to present. So our first slide here is talking about the difference between aggregated data and disaggregated data. So that sounds pretty fancy, but aggregated data is looking at a whole set of data formed by combining several parts. Like in this particular slide, they're looking at youth that are aged 20 through 24 that are not enrolled in school and not working. And so a lot of older parents are concerned about this, and they're showing this statistic that 48% have less than high school, and 32% only have a high school diploma, and only 20% fall into a different category. And so this kind of data, because it's graphic, and that's one of the things I want to point out, is that a lot of us are visual learners. And when we see just things in a pie chart or on a line graph or something like that, then we can visualize it better. And it also helps us to ask the question about, is this how I see it? Or is this a little bit different from how I see it? So that's aggregated data. Disaggregated data is a whole set of data that is separated into its categories or subgroups. Like we have subgroups by state in the mountain regions. And that may be important. But there also are different types of populations that we serve, like children who are found in newborn screening. I mean, that's like a group. So we always want to keep in mind which group we're trying to understand and how much do we need to break it out. So this is looking at racial differences. And so somebody might look at this graph and say, oh my gosh, this seems to be a bigger deal in the Native American population. And why would that be? And then that could open up the door for using some of the other techniques that we're learning in this this whole unit about, you know, trying to get more data by talking to people and that kind of thing. So next slide, please. Triangulated data is basically using multiple independent sources of data to establish the truth and accuracy of a claim. It seems like this year and the last few years, this has been the bigger deal because everybody's talking about fake data. And so you really want to know where your data is coming from and is it reliable? So what they're looking at here is college admissions and asking what kind of information are they looking for? And so they actually try to get information about their candidates from a lot of different sources. Their application, their ACT scores, their references, an essay that they might have them write, extracurricular activities, their grades, even an interview. My first job ever was I was a secretary for admissions at Vanderbilt Medical School many years ago. And so this is exactly what we did, is we had to organize all this data and then present it to a committee who would then make decisions based on that. Okay, next slide. So we're going to give some tips for interpreting graphs. And the most urgent thing is that you notice what the labels are. This particular chart has no labels, so we have no idea what they're talking about. Okay, so you want to know what is the information being represented by each column, each row, if it's like a spreadsheet or something like that, or the range of values. Where was the most change or the most growth? Where was the least change or the least growth? So you're looking at the relative representation of these numbers. And again, it's visual, and I think that's very important to communicating to an audience. Next slide, please. This is showing how every little bit of data is actually a snapshot in time. So you may have a survey that happens in 10 years ago, and you might be actually comparing data from 10 years ago to current levels. And then if you were doing that, you might have all these different categories, like this. Pie charts are great for this, especially because the colors really stick out about that one group is bigger than another group. But also you can do things like see how that division changes, say, decade by decade or over time, or if it's getting more one direction or another. Okay, next slide. Oops. This is showing what you can do by combining kind of modalities in different charts. Like this is showing that here you have the different colors that are showing you parts and pieces of each one of these columns, and you can see kind of, not only do you see that it's growing overall, but you also see which segment is growing a lot. And so you can see from this particular chart that, you know, because they put the numbers on the top, that's very important to have something visual that somebody can say, oh yeah, I can remember that number. And so you have 63, 217, 617, and on. And you can see that this number is more than doubling each decade that they're talking about. And so that helps you see the trend. And seeing trends is very important for trying to tell an audience that things are changing and we need to step up to the game and see if we can either change the trend or change our actions based on the trends that we're seeing in the chart. Oh, next slide. I was almost trying to change it myself. Oops. Back one more. Okay. And this is another type of graph. They're looking at 2 different age groups, and they're showing that when one is relatively higher than the other and kind of close in, you can see the difference in that. And again, the colors are very useful. Be sure that you're labeling well what your numbers are meaning, like this is a %. And so somebody can very easily see that these are age groups that are being represented in the chart. And then they can look at down here and see the different skills and things that they're talking about. All right, next slide, please. And so we're also going to be looking at analyzing the data.
Sorry, Susan.
I'm sorry.
I went one past it. Sorry. Go ahead.
Okay. I'm sorry. So we want to validate the findings and to make sure that all the data sources are sound. Are they trusted sources? Do people know what they are? You may need to follow up with questions in case there's some lack of clarity there. You can use different ways of gathering data, like you can use surveys or polls, or looking at published data and things like that. And you can ensure everyone agrees and accepts the findings, because there may be some people that say, well, that's not a credible source. So why are you using that? And so it is very important that we have this process of validation to understand that you understand your sources and how they got the data. Okay, and then the next thing is analyzing the data. Next slide. So you're going to be looking for relationships within the data. So each view will provide a unique insight. You're going to look from many viewpoints, and to make it very clear to your audience what those viewpoints are, you're going to understand the parts as well as the whole. You're going to understand the strengths and the challenges within whatever group you're looking at. You don't want to draw conclusions too soon. And you want to give, wait and draw your conclusions after you've gotten your feedback from your audience. You want to record information as it appears in the source. And then one of the suggestions they're making is that we use electronic health records, because a lot of those are done automatically now, and they have a kind of objectivity that we may not find if we were just making phone calls or something like that, like Gallup polls. All right, next one. So they're various terms that you hear, and some of you who are not that far from your math class might remember some of these, but I'm going to go over these just so that people remember what they mean. Your mean is the average of a group of numbers. So you have a string of numbers, and then you add them together, and then you divide them by the number that you have, and that gives you the average of that group of numbers. Often very close to that, especially if you have a big set of numbers, will be the median. And that's actually the middle value. So let's say you have 1,000 values, then what is it 500? And again, a lot of people confuse these two, but they're different. And then the mode is the most frequent value, and that might not actually be real close to the mean or the median, because it may be, depending on, if what you're measuring is something that's very skewed. If you make, some of you may remember the term a histogram, which counts how many items are at each level. And so some of those curves are very symmetrical, and then some are very lopsided. And that would make a difference, where that mode might be more off to the left or more off to the right. A range is giving you the difference between the lowest value and the highest value. And you need to know whether, a lot of times people use 2 standard deviations above and below the mean. And that will generally grab up about 97.5% of your population. But for some purposes, that 2.5 that's left on the outside is really too broad, and you really need a narrower end. So some people will only use 1 standard deviation above and below the mean, and then that gives you more what makes more sense to a lot of people. So it depends on the data that you're dealing with, really which one you want to use the most.
And I was just going to add, Susan, that sometimes we're looking at the 2.5% on the ends too, right? Sometimes we have to look at
well, we do, because oftentimes like doctors will not even will consider everything that's in the middle. I mean, from that 2.5% to the 97.5%, they'll consider that normal. And I always say, pretend that you're putting up a roadblock on whatever highway is the big highway in the city where you live, and you're going to stop everybody and say, do you have a medical problem? And I would guarantee you that out of 100 cars, you're not going to just get 2 or 3% on the front end and on the low end that have a medical problem, but most everybody in the middle is. And so you have to really think about how the data that you're generating is going to be used, because if they're going to decide that nobody needs to be treated except if you're 2.5 standard deviations above or below, then my goodness, that's not really how we treat medical system. We have people going in all the time and for lots of different conditions. So an outlier is somebody who has a very high or very low number. And for every different thing that you're measuring, there are probably reasons that are known and reasons that are not known why you might have an outlier. But you have to be really careful, because if you let the outliers skew your values too high or too low, then you're going to end up with data that really can't be used very well. And so this is just kind of a warning about that. And then the other thing that you hear tossed around a lot is the term statistically significant. And scientists use the term p-value, which what is generally considered to be statistically significant is a p-value of 0.05, which is 5 of 100, which is 1/20th, okay? And they think that the chances that something might happen by chance are only about that. But scientists often have numbers that are much higher in statistical significance than that. And the smaller that number is, the more likely it is that that data is really representative of what's going on. Okay. So when you're working with numbers, this is just an example. January reading scores, and you can see that some of these students are higher than others. And so if you were trying to figure out in this group of data what was the mean, it was 817. Well, goodness knows a lot of the numbers are a lot higher and a lot lower, but the way they're organized, and sometimes you can take data like this and organize it, you know, graph it where the numbers are in order by the number, you know, that you, and there are times when that's really a better way to represent the numbers. But the median is 825. The mode, which is the most frequent number, and it, you know, it was in here twice, and everything else was in there about once. So that's why it got to be mode. And then the range was 665 from the very lowest value to the very highest value. And then the outlier was this student here who got a score of 900, and they weren't that far of an outlier because the next one was 880, which is not that far off. But anyway, you need to always be able to identify who are the outliers. Okay, next slide. So,
ready for me to take it from here?
Yes.
All right. So thank you, Susan, for doing a great job on organizing and analyzing. So we're going to switch gears to developing hypotheses and making recommendations, which is step number 5. Hypotheses are the statement that you're going to put out. Sometimes it's an if-then statement, but it's going to be a statement based on what you think is going on with the data. It's a proposal to say, this is what we think. What we think is explains the data that we have. In our science, when we're wearing our scientific hats, you know, usually the hypothesis starts the testing and the experimentation phase. We don't do that so much with serving on groups, but it is a starting place to say, okay, this is what we think is going on. Now let's dig a little deeper to make sure. Or if we're going to implement something, let's see if that does have an impact on our hypothesis. So understanding why we think it is happening, looking at other data to take a deeper dive, asking more questions, and agreeing upon the conclusions within the group, and then figuring out possible solutions. And that's where a lot of our groups, specifically with Mountain States, I can give the example of our state teams. Our state teams are the ones that are figuring out possible solutions, possible projects, possible initiatives to address what they have found to be maybe roadblocks or barriers to care in their own states. So the next step is 6, and that is creating an action plan. An action plan is really, it has a couple steps to it. So the who, what, when, where, and how. So I'm going to use the example of state teams for Mountain States for this model, so you can kind of see how it works within our organizations. So when we started this grant cycle back in 2017, we decided we were going to have state teams, but they didn't exist before. So we had to bring key people together to form state teams. So that was our step 1. Then the state teams formed. They had to get to know each other. They had to figure out what was the question that Mountain States was asking them, what was Mountain States asked by HRSA, and what did that look like for them. The who was the people on the team, but they also had the greater who of who were they representing in their state? Who was the underserved population that was not receiving genetics care? The when was, how long do we have to do this? We have a grant cycle, a 3-year grant cycle. The where became facilitated calls, meetings, genetic summit meetings of where this work would be done. The resources sometimes came outside of the state team. Somebody knew somebody who had an expertise in that area of data, or somebody knew somebody who had a connection here. So the teams have often brought in outside resources to the team. And then the communication, and that in Mountain States looks like monthly communication with our state teams, whether that be in the form of a state team call, an in-person meeting, a check-in with the co-leads. That's kind of how it's worked within Mountain States. The state teams early on did put together some action plans, some things that they were thinking about pursuing. And now that we're winding down in our third year of our grant, we are now evaluating follow through. Some teams have funds left, so that they still have some projects that they want to finish completing in the third year. But now we're working on follow through of those plans, getting those wrapped up in our third year of our grant cycle. And then last but not least, we will be responsible as the holders of the grant for communicating that information back to our funders, which is Health Resources Service Administration, or HRSA. And number 6 is keeping track of the progress. And we've done that by involving in many of our projects our evaluator who helps us keep track of the data that's been gathered from those projects. So we can look back 3 years ago and say, okay, here's where state, the New Mexico state team was when they started, and here is where they are now. And then we can measure that difference. And then last but not least, celebrate our team's successes and the changes that have been made. So Susan, do you want to take this number 7, displaying and sharing results? Okay, great.
Yes, this is the part that I love the most, because I love making graphs and figuring out how to display and use that. So you want to make sure that your report, however you make it, is appealing, is accessible, is accurate, and is specific to your audience. And you want to be fair and objective. When we're thinking about that, you want to be sure that the reading level is accessible to your audience, and that you avoid jargon or acronyms that the audience doesn't understand. You want to use bulleted lists and language that is spoken by the audience members. So it's important to know your audience. And then you might need to be sure that your data is free of errors, because you want to communicate the right thing. And also, you also want to focus a lot on your particular audience that you're addressing. Okay. So you want to, when you share your results, you want to know the purpose of your report. Does it need to provide information? Is it to raise awareness? And when you say that, you need to know about your audience enough to know what data sources they've been using and where they're likely to have developed an opinion about what you're going to talk to them about. Will it be used to make decisions? And this is especially important. A lot about this whole serving on groups organization and everything is trying to enable you as a leader of other people to well represent that group towards a larger group that may be a decision maker. We talked about the different kinds of committees there are, that have different purposes and everything. So you need to figure out, is this a group that is making decisions, and what kind of decisions are they making? And so how do I display my data in a way that is useful to them? And so what do they already know about the topic? Or do they have misinformation about the topic? And are you trying to show them data in a way that makes them understand that maybe they haven't seen an angle to this area that they had never heard of before? Do they need the big picture, or do they need lots of details? And one thing about that is that, generally slides are trying to give somebody a big picture, because you can only process so much visual detail in one whack. So next slide, please. So you want the data to come alive, and you may have noticed this kind of happening as more tools of doing all kinds of visual data manipulation has gotten out there. People like to, it's sort of calming to have pictures of things that are familiar to your world rather than just numbers. I mean, none of us really has an emotional, attachment to a number, but you might have an emotional attachment, say, to a pencil, which, they're trying to use the length of a pencil to represent how many students they had here. And then they're showing the size of the building to represent how many people they're talking about here. And so that's why you do need to think about what is the emotional side of what you're presenting. And are you choosing the way to display it in a way that's concrete and makes sense to your audience? And I do want to say that I have been very grateful, Christy, being in Mountain States, that I've been more sensitized to the fact that, like, somebody living in the middle of nowhere may have a different point of view, and they may even have family customs and customs of, we talk about this or we don't talk about that may be different from my own. And so this is why it's just so important to know your audience and then to make the data come alive in their world. And so so data stories help, having a compelling narrative, being very audience specific. Try to find information about what's going on with your audience. When I was in right out of college, one of my roommates worked for the college that we went to, and her job was to collect data from newspapers and just anything about any of the alums, so that whenever they would make a book for the dean, so that whenever he went to a meeting, he would say, "Oh, I heard your daughter just got married," and so they would know things that, they didn't have time to do all that, but that they went to the gathering information stage. They made sure that they could be audience specific and make everybody feel like they belonged. And so you also want to be objective. You don't want to censor, because, if you censor things, then they will come back and bite you later, because they don't go away. And you also want to explain the data. Whoops. Can you go back?
Sorry.
To the next slide.
Oh, can you see make the data come alive? Sorry.
Yes.
Okay, sorry.
So now we're the next slide.
You ready? Okay.
I'm ready.
There we go.
So Christy liked this. She saw this on my website, because I have a group that has about 22,000 members on it now. And so I thought one day it would be fun, because the Facebook collects this information about where do people live. Because, for you to feel like this comes into your world, you want to see that there are people that live where you live. And so I thought it would be an emotional thing, that it would connect people to the group more if they could see where everybody in our group lived. And so we actually lived in 100 countries and 100 cities. And I don't know if maybe they stopped counting at 100, I don't know. But this is the graph that I made from the data that they gave me, and it was just numbers, but this made it come home to people so that they could look and see what state they were in, and they could see, so each state kind of has a different number, and the cities have, you know, a different size of the slice there. And so this was, it was amazingly successful in making people feel like they belonged. And so you may not think about data doing that, but it certainly did in this case. Okay, next slide. And we're seeing more and more data displayed like this, where it is trying to be more human and trying to, you know, show us that we're all connected. And so visually, they're presenting statistics, but they're doing it in a way where it has an emotional appeal. So if all people are affected by a rare disease lived in one country, they would make up the world's third most populous nation, the equivalent of the total US population. So, you know, they made this graph and had everybody holding hands over the whole world. This means that 300 million people around the world have a rare disease, approximately the same number of monthly users on Instagram. So they're bringing something more familiar to the world and expressing their data in terms that are familiar to the group they're talking to. So they're saying globally, 50% of those living with a rare disease are children. So here they have a little picture of children and adults, and then this equivalent to 3.5 times the combined global annual number of visitors to the Disneyland parks. Why did they say it that way? Because they were appealing to where the audience was living. And again, this is all that sort of thing where they have the person who made this slide made it where it's going to relate to the audience in a way that puts the unfamiliar in more familiar terms. Like a familiar term is how many people go to the World Cup, and you see the you know, how many people are in the stadiums. Okay. Another way to present the data is to represent people, you know, think differences in color. So this is 1 in 10 Americans are affected by a rare disease. And so to get that across, they're just making one person look different. And so it's great. I mean, it's getting easier to produce this kind of data. So why not? Why make it look blah when you can make it have that emotional appeal? And that's what we're trying to do. We're serving on groups. We're trying to motivate those groups. We're trying to motivate change, and that's how we do it. Okay.
Thank you, Susan. Awesome. Yeah, that last graphic there was from our last grant cycle for Rare Disease Day. I was looking at some of those infographics and thought, gosh, this is a lot of information to put out on Facebook. So I just took one of the statistics and made a graphic for it just to highlight one of the pieces of data in what's becoming much more popular in little bite-sized chewable pieces on social media these days. So I am going to take it from here for continuous monitoring for progress and improvement, the last step, which is number 8 here. And the reason I asked Susan if she would let me do this one is because we are doing some of this within Mountain States, and I wanted to use a Mountain States example. So some of the things that we need to keep in mind when we're doing continuous monitoring is checking our work, revisiting that action plan that we made, identifying challenges and making changes as needed, and being flexible enough to say, you know what, we thought that this was the underserved group in our state, but guess what? We've got some new data. We have some new information, and maybe we need to shift a little bit, or maybe we need to address 2 different groups. so also evaluating the action plan and collecting the same type of data from the same data source so you can measure apples to apples. And we're doing this within Mountain States, and I wanted to use an example here. So this graphic here says continuous improvement, plan, do, check, act. What we're using in Mountain States is something called PDSA. It's a slight variation on this, which is plan, do, study, act. But it's a continuous quality improvement initiative. And all of the genetic networks are asked to do some type of project within their genetic networks where they are using quality improvement techniques, such as this what we call a PDSA cycle, to evaluate them. So what we've done in Mountain States is we've done this with our Facebook Live presentations that we've been doing. We started these in January, and we actually first got qualitative data by launching a survey back at around the Genetic Summit. And we put a survey out on Facebook asking consumers what their genetic questions are that they would like answered. We collected that in the form of a Survey Monkey, a lot of qualitative data, a lot of questions, just questions people had about genetics. And then we reached out to genetic expertise in our region, geneticists, consumers, genetic counselors, and we asked them to answer one of those questions. We recorded their responses to them, and then we put that into a video format, and we play those once a month on Facebook Live. Now, each cycle of those, each month that we do that, we change something slightly. And that's part of this PDSA cycle, or plan, do, study, act. And so we plan ahead. We say, okay, we're going to host this on Wednesday evenings after work time. We do it, we launch it, we study it, and we study it by using Facebook data that Facebook provides to us on how many people watched it, how many people were engaged, how many people did it reach. And then we act. We say, okay, we're going to make one small change. How about we try advertising it on Monday and sending people a reminder on Wednesday and then doing it at the same time. So we do something, we make a small change, and then we go through the cycle again. So this is just a small example of how you can do continuous monitoring or quality improvements with your projects and with your data. But we're asking the question each time how we're looking at it from a perspective of consumer engagement. And so we're looking at the consumer engagement number that Facebook provides to us and saying how many people did we engage? How many Facebook users, how many people out there watching Facebook were engaged with that content that we put out? And then we say, did the number go up or did the number go down? Was it better when we showed it on Wednesday nights, or this last month, we did it on Wednesday at about lunchtime in our region, and we had a lot more engagement. So these slight changes can give you a lot of valuable data in the projects that you are doing. But you have to have data to be able to compare one to the other to know if you've made an improvement or not. All right, so just to review, these are the 8 stages that we just spoke through. We did the planning and preparing to use data, the collecting of the data, how to organize the data, how to analyze that data. Then we went to developing hypotheses and making recommendations. Creating that action plan was number 6. Displaying and sharing results, Susan's favorite, was number 7. And 8 was continuous monitoring and progress or quality improvement. And that brings you back to planning to prepare to use the data again. And it's just a cycle, and you can continue going through it with the groups that you serve on to continue making changes that are positively impactful. So, sorry, I should have been clicking through these. Here's all the 8 steps. And these 2 forms here that are understanding data as information are actually found in the spiral bound notebook that goes with the Serving on Groups training, the one with the tabs and the orange cover. And again, if there's anyone on the call who was not with us in person in last Genetic Summit who would like one of those books, we are happy to mail you one. Even though this is the last session, there's a lot of useful information and a lot of useful forms in there that you can use in your own groups that you're serving on. So these are 2 specific ones for data that walks you through all the stages and allows you to kind of answer some of the questions that we talked about today. about your data. Now, this is a really overwhelming slide, and I don't mean for it to be overwhelming, but this is a ton of data links of data that is already out there that is free. So if anyone would like these links, I'm happy to cut and paste these into an email for you so you don't have to type it or write anything down from the slide. And this slide deck will also be archived on the website. But there's things for disability statistics, there's data for MCHB Title V, and that might be just a bunch of letters to you, but that stands for Maternal and Child Health Bureau, Title V Information Center. And within Title V is children and youth with special healthcare needs. So that data information center could get data for individuals that we are representing, children and youth with special healthcare needs, within their data set. There's also things like high school survey data, there's state education profiles, and another one that's really great is the one on the left-hand corner there that says Data Resource Center for Child and Adolescent Health, a project of the Child and Adolescent Health Measurement Initiative, which is the CHAMI. I've been on their site, it's just childhealthdata.org, and they have a lot of data that can be very helpful for the populations of individuals that we are representing. So this is a big data dump right here of all the places you can go for source data that won't cost you anything. Much of this is governmental data, and you can drill down to the level of your state and oftentimes to your community and even sometimes your zip code or your town. So if you would like this information, please just email me and I'm happy to copy and paste this into a slide for you so you can click on those sites. All right, this brings us to the end of our Serving on Groups training, and I just want to give a quick overview to kind of put everything in perspective that we have talked about. So you're probably asking yourself, okay, what's my next step? So if you want to learn more about personal skills for serving on decision-making groups, and you have not been able to just join us for every single one of these, this is kind of a plan for you to go back and review. Of Section 1, opportunities to get involved. Section 2 was types of groups. Section 6, we just did today, which is the data one. And Section 7 and 8, role of families, and then skills for serving on groups. If you are at the point you're ready to learn about group skills for serving on a decision-making group, the ones that they highlight for those, specifically for group skills, are types of groups, processes groups use, tools groups use, tips and strategies, and understanding data as information. Again, that last one is the one we did today. So depending on where you are, you might be at a personal level where you're seeking to join a group for the first time and serve on a group for the first time. I would say you probably would do the light blue box. If you are already on a group, you're leading a group, or you're involved in a group, you might want to review the things in the green box. But I am happy to talk with anyone on the call, any of our genetic ambassadors on a one-on-one basis. If you'd like to schedule a time with me that we can talk about where you're at and maybe what your goals are, because there's opportunities that come across my desk all the time for opportunities for families to serve on groups and individuals to serve on groups. So if I can be helpful in helping you get to your next step, I am happy to do that. So please keep that in mind and reach out to me and let me know if I can help with that. Here is the Serving on Groups website. If you want any more information, they have a lot of the information. This is where we ordered the guidebooks from. The guidebooks is that spiral bound notebook, but it's just servingongroups.org. And then this whole training came to us by way of National Family Voices and their Center for Family Professional Partnerships. And so this is their website, because they are currently right now training other trainers to do this presentation and this training. And like I said, Susan and I and a couple other people from our region went through this training 2 years ago, almost 3 years ago now, at the Family Voices National Conference. So these are some thank yous from Family Voices on the people who reviewed this training. Maybe see some familiar names up there. Trish Thomas is up there, who's our lead for our New Mexico state team. And then last but not least, here's a thank you slide for this entire training. And it says up there, right under the big thank you letters, please remember to complete the evaluation. And I will be sending the evaluation out after this call. I've been sending it out all along after every section, but sometimes people haven't done it. So guess what? That's okay if you haven't done the evaluation yet. You can evaluate all the sessions that you attended in one fell swoop. It's the same link I'm sending out each time. It will recognize you by your name and email, so it should pull up. If you've entered ones before, it should find you in the system, but you can evaluate all of them at the same time. So I'm gonna be doing one last email to say, okay, anyone who's not done an evaluation, please evaluate the Serving on Groups training. This data is really helpful for Family Voices and their funders, and it's also helpful for Mountain States to be able to show that we did this training and that we reached individuals in our region as well. So please, 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 with the cherry on top, do the evaluation when that comes to your email address from me. All right, I'm gonna stop there. We are 6 minutes past the hour. I did schedule today's call for an hour and a half. If anyone needs to jump off, that is perfectly fine. We totally understand and respect your time. I have just about 10 slides that I wanted to switch over to for Mountain States, just to give a couple Mountain States updates. So let me just switch over to that. Let's see here. Here's my share, there we go. And I'm gonna just share my screen there again. Can everybody see that? Susan, can you see, is that full screen there? Perfect, thank you. All right, I usually do just a bit of our call with just some updates on Mountain States. And so I just wanted to go into that. I don't have too many big updates because we have been busy preparing for our Genetics Summit, which is just about a little over 6 weeks away. So let me get into this. I always start with our mission because it is really important to remember what we are doing and where we're coming from and what we are focused on each and every month. So we're ensuring that individuals with genetic disorders and their families have access to quality care and appropriate genetic expertise and information through facilitating a professional network of genetics clinics, key primary care practices, consumer advocates, that's all of you, and state health department resources. And there's our funding statement. Again, we are funded by HRSA, Health Resources Service Administration. And so this is our last and our third year of our grant cycle. This is a little bit about me. I know I've talked with almost every one of you on the call. So I love what I do here with Mountain States and love this Genetic Ambassadors program that we've launched in this grant cycle. For those of you that are new to the call, to be a genetic ambassador, you just have to live in one of our states, and you have to be a consumer of genetic services. That includes parents, family members, family leaders, or individuals with genetic conditions that live in one of our states in our region. I do want to tell the new folks that have joined us for this call that we do have a Facebook group for genetic ambassadors, so everybody can connect with one another. And if you would like to be invited to that group, just send me an email and I will send you an invite through Facebook. I'm pretty sure I got the 2 people that wanted to be added last time. I think that all worked. So if anybody is not on the Facebook group and would like to be, just reach out to me. And this slide is what we've been busy at work doing. This is our Genetics Summit announcement. It is September 23rd through 25th. I know many of you on this call are coming in some way, shape, or form. It's going to be in Albuquerque, New Mexico. All of our scholarships have been awarded. We had an overwhelming response to our scholarships this year. We had about 32 individuals apply. We only had some limited amount of scholarships, but we have been able to have 12 scholarships recipients attending. So thank you to everyone who shared the information about the consumer scholarships, and thank you to everybody who applied. I'm so sorry that we could not bring everybody, but there are many other ways to get involved with Mountain States than just being at our summit. So I'm so glad for some of you that you're able to join the call today. Just a quick update, all of our genetic pop-ups for the spring have been completed, and I just want to say a big thank you to everyone who did those. They're noted here. Susan, our guest speaker today, was one of those. We are planning a panel at the Genetics Summit with a couple of individuals who did those. Maria and Jesus will be speaking, Alice and Thomas will be speaking, and Kathy and Fran will be speaking about their experiences. And we also are planning on having more genetic pop-ups in this grant cycle. So stay tuned for that. You will hear about it first on these genetic summit or genetic ambassador calls. So please tune in here. But we do plan on having some more genetics pop-ups coming. And then this last slide, I would love, we had talked about this just real briefly on our last call, but I would love, love, love to switch formats in October to a new call format. So we won't have a genetic ambassador call in September because we will be at the Genetics Summit. But in October, we'll be having a genetic ambassador call. And I would like to seek your input on what everyone would like to learn and talk about. We started this discussion on the last month's call. But because we are done with the Serving on Groups training, I want to fill that time with what you all are in need of and would like to hear. So if you, I'm going to open it up for a little bit of conversation here. These are just a couple ideas. There's other trainings out there that we could do. There's leadership trainings, there's advocacy trainings. There are speakers. Some people have mentioned that maybe it would be nice to have a speaker on every once in a while. We have state team projects that are being led by consumers and who are serving on state teams. They could come in and report on that. There's advocacy projects going on, and there's upcoming events in our region. So I'm going to stop talking for a few minutes, and then feel free to unmute your line and chime in on what you would like to see or learn about or be equipped with on these genetic ambassador calls going forward. Anybody have any comments? Is everybody on mute? Don't be shy. Daphne, are you on still?
Yeah,
Do you have any ideas?
Just trying to think about what would be helpful. You know, it would be nice to know what other organizations are doing in their areas to promote genetic services. Like I know the people in Texas, but I don't know the people in all the other states.
Okay. So do you mean like specifically in our regions, what other state teams are doing? Is that what you mean?
What else? I know we'll hear about that at the summit, but what all organizations are involved? Occasionally I get phone calls. Well, I got a phone call last week from somebody in Wisconsin wanting to know, they'd just been diagnosed with EDS and they wanted to know, you know, what kind of doctor do they need and what are the services available. And this is Wisconsin. I live in Texas.
Right.
Yeah, I can tell you everything about Texas, but
right.
We had talked about at one time putting together resource lists, and maybe it's time we sat down and did that together.
So I'm going to forward ahead on a couple slides here real quick because I want to show you something. This is my last slide. I don't have this for Wisconsin, but I have this for the states in our region. I wanted to highlight this today to everybody on the call. All of our state team pages have been built out. Now those are built out by the state teams in all of our states. So when you go to our front page of our website, and again, this doesn't help you specifically for Wisconsin, Daphne, but I do want to show this for at least our region. Whenever you go to our front page of our website, there's a clickable map. It's that purple map right there. Each one of those states is clickable. And when you click on it, it is a page that has been built for families in those states for genetic resources. And so at each state team, so Montana has built their own state team page. Arizona has built their own. And so those house the resources that we know about in those states and kind of the navigation, I guess, a starting place navigation of where you would go for genetic services in those states. So we've done that in our region. Not all the regions have done that. But I can tell you for our 8 states, we do have that as a starting point. Is that helpful?
Yes, but one of the things I did last week when I was at the EDS meeting, the conference, and was a little bored during something, to be honest, besides playing on my phone, I went and started looking up the other regional networks.
Okay, right.
The Pacific and the East Coast, and I found some really cool things that they were doing, and it might benefit everyone to look into what the other regions are doing.
Absolutely. And we actually, Annette, attended by phone, and both of our project directors actually went to a all-region meeting last week where they all shared their resources with one another. And so that is a great idea that maybe, are you suggesting, I don't want to put words in your mouth, but are you suggesting having other people from other regions come on and share what their consumers are doing, or what other consumer-friendly projects they're doing in their regions?
I think that would be great. It was very interesting to go to the web pages and see different tools that they had developed, and educational programs that they had developed, and all kinds of stuff. It was really interesting.
Okay, perfect. I'm writing that one down, and I can definitely work on that. I can also do, we can also do on another call some investigation into something called the resource repository that the National Coordinating Center has done, which is, the National Coordinating Center is the group that's over all of the 7 regional genetics networks, Mountain States being one of them, and they catalog all the resources from all of the other regions, and they've made it into a graphical online tool. So that's something else we could possibly highlight and show people how to use that.
Well, that sounds great too.
Okay, I'm going to write that down. Okay, I didn't mean to call on you, Daphne, but your name popped up. Anybody else would like to share? Adrian, do you have any ideas? Who else is still with us on the call? I just saw that you joined, Adrian. I'm adding you to my list. And who else? Stephanie's on. Stephanie, is that Stephanie Aurora?
It is. How are you?
It is. Oh, thanks for joining, Stephanie.
Absolutely. No, I think it's all good stuff. I'm just sitting here kind of getting my head around, I've been out for a while, so.
Yes, and I don't want to overwhelm you because I know this is the first call you've joined. So don't be overwhelmed by this. We're just switching formats just a little bit since our Serving on Groups training has ended.
Okay. Good session today.
Great. Thanks for joining us. Go ahead. Somebody else was going to say something.
I was going to say something, Christy.
Yeah.
I think it was for the last summit that I did a one-page sheet on all of our ambassadors that were willing to furnish it to me.
You did.
That was making kind of a booklet so that we would get to know each other, and it was actually each person could just put on it whatever they wanted to.
I love that. Are you maybe suggesting we do it for these calls?
I just think I would really like to have that be something that we maintain, and then when we add new ambassadors that we ask them to make a one-page sheet, and then maybe we could have it somewhere where people could download the updated one that has the people that are currently in it.
That sounds like a great project for the Genetic Ambassador Group. What do you think?
Well, I think we really need to know each other.
No, I love that, and that's why I want some of these calls maybe to not have so much structure as we've had in the past, that maybe we'll have a little bit more time of sharing. So I was also wondering what your guys' thoughts of that were. Maybe just a round robin kind of sharing what's going on with your own organizations. Maybe once a quarter we do a round robin sharing call.
Yeah, I'd be open to that. Sorry, I couldn't talk before, but now I can talk.
Who's that?
This is Adrian.
Oh, hey, Adrian.
Hello.
Thanks for joining us today.
Absolutely.
You just got back from your conference, or not too long ago.
Yes. Yeah, that was amazing.
That was in Texas, wasn't it? Houston?
Houston. Mm-hmm.
Yeah, great. Well, so that's another idea I had. You said you would be up for that, kind of sharing what's going on with your disease-specific, organization-specific events and things.
Yes, and I think that would be helpful just to see what other organizations are doing, and maybe, getting ideas for our own organization, what are other people doing to maybe forward our progress.
Okay, perfect.
Christy, can you hear me?
Yes,
this is
who's
Winton.
that?
This is Winton.
Oh,
I finally.
Winton. Yay!
Hi. Yeah, I'd love that round robin, the sharing, and I sent you a few emails about just getting some more information and preparing to join the New Mexico group for this summit. And I'd love to also share about, with the round robin, eventually, what the Center for Development and Disability Information Network is doing with your other ambassadors.
Great. Thank you so much for joining us today. And we're excited. You are one of our scholarship winners, so we're looking forward to meeting you in person at the summit.
Thank you. I'm so looking forward to it.
Great. Thanks for joining us today. Well, you guys have been helpful. This gets me started on, we're going to also have a networking session at the summit where we're going to be asking some more questions around genetic ambassadors and resource sharing and things. So if you're there on Monday night, that's the networking session. I'll be leading one of those tables where we'll be asking more of these questions. So I've got some things written down to get me started, but I wanted to just go back whoops. Hang on. There we go. I just want to go back a couple slides for the new folks. Goodness, there we go. Here we go. I just wanted to point out for those of you that are joining us for the first time, we do have a Facebook page and a Twitter page for Mountain States. And a lot of the resources that I find out about from other regions and things, I'm always sharing them on there. Like I just found out about a newborn screening video for midwives that has been developed. And I just found out about a telegenetics video for consumers to talk about what it's like to use telegenetics for the first time, maybe with your doctor, that was developed by a different region. So I've got those. They should be either, one of them should be posting today, a couple more this week. But those are, as I find resources, I'm always sharing them on the Facebook page, and Annette's putting some of those on Twitter as well. So I just wanted to make you guys aware of that. And then just to orient you to the website, all the stuff that we do with genetic ambassadors and those Facebook Lives I was talking about, your genetic questions answered Facebook Lives, can be found under the For Families tab on our website. The drop down should say genetic ambassadors and your genetic questions answered, but that For Families tab is where I archive a lot of our information. And then this is the state teams page that I mentioned before, so check that out. If you have a resource in your state that's not on that state team page, let me know about it, and I will take it back to the state team and ask them to review it and ask them if they'd like to add it to the state team page. But if there's something you know about that perhaps the individuals on our state team don't know about, we're all a team. We can't know everything. Our state teams can't know everything. So we look for input from our genetic ambassadors too, of something that they know about in their state that we can make sure everybody else knows about. And last but not least, there's my contact information where you can find me. Feel free to email me with any questions. Like I said, on the serving on group stuff, if you're not sure where your next steps are, if you're looking for a group that you'd like to serve on, please reach out to me. I'm happy to help you brainstorm and help figure out what your next steps in advocacy are. And I am so excited to see so many of you at the summit in, like I said, just a couple short weeks. You might want to check out our summit page. We've added so many things there. The agenda is up, and also I added an about the artist page because I don't know if you saw. Let's switch back here. This beautiful picture of DNA that's on our Genetics Summit is done by a native artist from the Zuni Pueblo tribe. And she is it's got an amazing history behind her artwork. And it's so anyway, I have made a about the artist page so you can read a little bit more about her artwork and what she's doing with it to help inform others. So anyway, I'll stop there. If anybody has any questions for me, I'm happy to answer them. Does anybody have any questions before we go? Was there anybody on the call that didn't get to introduce themselves that would like to before we end up here?
I can introduce myself, Christy, finally,
yes.
Now that I have this
Please, yes, now that it's working. Is that Winton? Go ahead.
Yes, this is Winton. Hi, everyone. So my name is Winton Wood, and I am first and foremost mom to two daughters. Lilia is 13, and she has Down syndrome and a bunch of other disabilities and medical issues. And I also am a family specialist and information specialist at the University of New Mexico's Center for Development and Disability Information Network, which is not on our New Mexico page. So I need
there
to
we
get
go.
that.
Please
Yeah,
send
because
that
we're
to
a
me.
really good resource for the whole state. Anything that's disability related, we help people find resources. So yeah, I'll
Great.
send that
Please
to
send
you.
me that. Send that to me, please. Yeah, thank you.
Sure.
We're
Thank
so
you.
glad to have you. Thank you.
Thank
And
you.
Stephanie, I'm sorry, I failed to have you introduce yourself too. Did you want to introduce yourself real quickly?
Sure. My name is Stephanie Aurora. I'm from Arizona. I guess best way to frame it is I'm mom of Eric. My son passed away a couple years ago. He had long QT syndrome. So I'm here for learning for myself, but also trying to see where I can maybe contribute and support the cause. Had we known he had this condition, we could have saved him. So I think there's some work to be done.
Thank you so much for being on today, Stephanie. And you came to our last grant cycle, I think, annual meeting, right? When we met in where were we? I'm trying to think. Were we in Utah, Salt Lake City, maybe?
Sounds right.
Thank you.
It's been a weird couple years, yeah.
That's okay. We're so glad to have you. Thank you so much. And I know you have on your heart to look into this as maybe newborn screening type screening or early screening, so that
yes.
families are aware.
Absolutely.
Yeah. Thank you. Thank you for sharing. Anyone else? Adrienne, did you want to introduce yourself? You came after we did introductions. Oh, she might not be able to talk. She might be on mute. Okay, well, it is just, it's right at 3, almost, we got 3 more minutes, so I'm gonna end up early if that's okay with you all, unless anybody has any other questions. But you can always get to me find me on email, or feel free to call or text my my cell number. All right, thank you so much. Oh, thank you for joining us, and thank you, Susan, for your contribution today and helping me with the data slides. All right, I appreciate everyone. Have a good day. Talk to you later.
Christy.
Thanks, guys. Bye-bye.
Bye.